day everyone, I am Maria-Paula Valenzuela, a student nurse from ISU Echave. And for today, I will be performing the turn demonstration and the assessment of the mouth, throat, nose, and sinuses. So prior to performing this procedure, we have to, of course, perform the proper hand hygiene and don our PPE if necessary, and gather the equipment needed. Ma'am, I am Maria-Paula B. Valenzuela and I will be your student nurse for today. Ma'am, what do you want to call me, ma'am?
Dyrel.
So, Dyrel, do you have any problems with your nose like frequent cold sinus infection?
No.
No. Any problems with your teeth or mouth that you are aware of?
No.
So, okay. So, I'm going to start to inspect your mouth. But first, can you wear this gown to reduce your chances of being infected? Now we will now inspect your mouth. Did you wear a lipstick, ma'am?
No.
So we will now first inspect the lips. And we will observe her lips for consistency and color. So her lips is resilient, smooth, and have a homogeneous pink color. So it is normal, ma'am. Then next, we will inspect the teeth and her mouth. Can you open your mouth, ma'am, for me? And we will now count the number of her teeth. Open wide, ma'am. Sa taas. So it's 32. Next, we will observe the color and the condition. Can you open again your mouth, ma'am? And after we inspect her mouth, ask the client to bite down as though chewing on something, and note 10 alignment of the lower and upper jaws. Can you please bite like you are chewing, ma'am? So, okay.
And then put on gloves.
Then next, I will now inspect the buccal mucosa.
Inspect and palpate the inner lips and mucosa for color, texture, and presence of lesions. Use a pen light and tongue depressor to retract the lips and cheeks to cheek. Observe the color and consistency. Also note for Stannon's duct. The buccal mucosa of the client appeared as uniformly pink, moist, soft, glistening, with elastic texture. Inspect the surface of the tongue for the color, moisture, size, and texture, and ask the client to stick out the tongue and observe for the fasciculations and check for midline protrusions. The tongue of the client is essentially positioned pink in color, moist, and slightly rough.
And next, we will now assess the ventral surface of the tongue. Ma'am, can you touch your tongue to the top of your mouth? Can you touch your tongue to the left mucosa, ma'am? To the right, ma'am. And then we will now inspect the Wharton ducts.
Then palpate the tongue and floor of the mouth for any nodules, lumps, or excoriated areas. Use a square gauze pad to hold the tongue to each side. Palpate for lesions, ulcers, or nodules. No lesions, ulcers, and nodules are apparent.
And then next, we will now check for strength of her tongue by placing our fingers on her external surface on her cheeks. Ma'am, can you press your tongue tips against inside of your cheek to resist pressure from my fingers? Again. Again. Then next, your right. So, okay.
Then inspect the hard and soft palate for the texture, color, and the presence of bony prominences. The smooth palates are light pink and smooth, while the hard palate has a more irregular texture. Then inspect the uvula for position and mobility. Apply a tongue depressor to the tongue and shine a pen light into the client's wide open mouth. Note the characteristic and positioning of the uvula. Watch the uvula and soft palate to move while the mouth is wide open. Note any unusual or foul odor. The uvula of the client is positioned in the midline of the soft palate. Then inspect the oral pharynx for the color and texture, keeping the tongue depressor in place. Shine the pen light of the back of the throat. Throat is normally pink without exudate or any lesions. And then next, inspect the tonsils. Inspect the tonsils for color, size, and presence of exudates or lesions. And then grade the tonsils. Grade 1, which is tonsil behind the pillar. Grade 2, between pillar and uvula. Grade 3, touching the uvula. Grade 4, in the midline. And then next, inspect the posterior pharyngeal wall. Observe the color of the throat. Note any exudate or lesion. Then inspect and palpate the external nose. Note for color, shape, consistency, tenderness. The nose must appear symmetric, straight, and uniform in color. Lightly palpate external nose to determine areas for tenderness, masses, displacement of bone, and cartilage.
The next, check the patency of the airflow through the nostril. Occlude one nostril at a time and asking the client to sniff. So, kailangan nyo pong mag-sniff or suminghot one nostril at a time. So, cover po natin yung isa. Singhot. So, then the next part, singhot. So, next, we will now inspect the internal nose using our pen light. Use your non-dominant hand to stabilize and gently tilt the client's head back.
For the presence of redness, swelling, growths, and discharge, the nasal mucosa is dark pink, moist, and free of exudate.
And now, we will now proceed to sinuses. Ma'am, I will now palpate your brow. Just let me know if you feel any discomfort. Do you feel any pain, ma'am? No.
Palpate the frontal sinuses by using your thumb to press up on the brow on each side.
And next, I will now palpate the maxillary sinuses. Place your thumb just under the zygomatic arcs, or what we call the cheeks, and press up on the maxillary sinuses. Can you tell me, ma'am, if you feel any pain or discomfort? Do you feel any pain, ma'am? No. And then we will now percuss the sinuses. Lightly tap over the frontal sinuses and over the maxillary sinuses for the tenderness. Do you feel any pain, ma'am? No. 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 And now I'm going to demonstrate how to transsimulate the frontal sinuses.
For the frontal sinuses, as you place the light just below the brow and you cup your hand over the light, looking for a warm red in the frontal area, and do the same in the other side. To transilluminate the maxillary sinuses, ask the patient to tilt her head back and open her mouth. Place the light source against the cheekbone just below. The presence of the reddish glow on the hard palate indicates a normal air-filled sinus.